Hey, this is Gary. He's a patient of mine. He's got a few little acne scars on the cheeks that we've been treating for how long, Gary?
About a year and a half.
About a year and a half. We've done several different modalities. We've done some Infinity, some micro needling, and we use filler for what is left behind. So I've mapped out what we're doing today, and I'll explain it. I'm going to combine a technique called subcision with filler injection. And what subcision does is it releases the adhesions that scars have to the subcutaneous tissue so that it can help depressed scars lift. So a couple of things, would you sit your head up a little bit, Gary? A couple of things I'll show you. He has a combination of some volume loss, and if you're young and you have acne scars, as you age, they seem worse because we lose volume in our face. And so even scars that used to be invisible can become very visible and create a shadow to the face later in life. So the white boxes are where he has depressions in his volume. So by lifting that, it can help support the areas that are depressed from volume loss. So I'm going to do deep volume injections everywhere you see the white. The green indicates areas that I need to subcise, areas that I detected were detached from underneath. And so I'm going to use my needle to release those adhesions by passing it in a fan-like way, the needle under the tissue, and try to detach those adhesions. And then finally, the single black markings are where I need to put a small amount of filler to take that superficial depression and lift it to the level of the skin. So I'm trying to fix the contour deformities at every level. With these methods, I'm going to be using two types of filler, one deep filler and one superficial filler. And then subcision is just done with some deep injections of lidocaine and then a needle, and there are special needles that you can use for subcision. So stay tuned. I'm subcising the area with my needle to break up those collagen bands that are formed underneath the skin, so these depressions can lift up. Okay, so now this is the last step. I marked where he needed superficial injections, so this is a little bit of Juvederm, and we backfilled some insulin syringes so I can make little tiny injections without putting too much in. So this is just to pull up those superficial spots. Also using my thumb and forefinger to feel any other superficial defects in the skin. Since there's a lot of lidocaine in the area, I don't want to miss any. So what I can't see, I can feel. It feels very smooth. Okay, so we're going to have Gary ice for a minute, and then we're going to take him into our laser room. I do think he may have some bruising, but we're going to get ahead of it by treating with our V-beam laser, which we do here in the office the same day of treatment at no extra charge if I do see that there will be a bruise.